State of Texas, DSHS has informed public health departments that they have adopted a revised definition for COVID-19 probable cases. This has the potential to be a very significant event for us here in Texas and here in Collin County, as the state now has elected to adopt this new probable definition. The definition, this probable case definition, was adopted by the Council of State and Territorial Epidemiologists back in early April 4th or 5th. They adopted this. They sent it to the CDC, and the CDC did take that recommendation and adopt it and send it out to the various states for consideration. And so now Texas DSHS has adopted this definition and will be using it. If someone has 2 minor symptoms or 1 major symptom, that qualifies. So 2 minor symptoms: fever, headache, sore throat, chills. And fever, by the way, can either be measured fever or subjective fever. They just feel like they've got a fever. If you have a subjective fever and you have a headache and you live in Collin County, you now meet the qualifications to be a probable COVID patient. It is remarkable how low the standard is now. Mm-hmm. I don't think it can be overstated here that how much this could be taken out of context and could be giving a false narrative to our citizens and to our community. I'm not saying that we're going to see the numbers jump, but I'm very concerned that we absolutely could see the numbers jump very rapidly in a way that actually is not indicative of what we're seeing here in the community in the public health department. And so I fear that this is coming at a time when we're just now starting to reopen, and if the numbers jump in a false way, it's going to start to be very concerning to our citizens that we're actually going backwards. And the state has used part of their CARES Act funding to hire a private contractor to take over contact tracing and to do reporting at the state level. And all of the labs that are done for Collin County residents are going to be reported to the state instead of to us. There's a potential that the probable case numbers are about to shoot up, and folks are going to see the curves and the trend lines are going to change, and they're going to have lots of questions. And that frustrates me because I know we're all going to work hard to make sure and get this message out, but despite our best efforts, it will be very hard to get in front of this story. For those that don't know about this case definition, who don't understand it, when they see these dramatic increases in numbers, they're going to be inclined to think either that we've hit some different spike, and now, quite frankly, we have this new pandemic raging through the community, which is a false narrative. That's not at all what that is sharing with us and communicating to us. Or they're going to be inclined to think, well, we weren't doing an honest job with the numbers prior to this. For those that do know about this narrative, they do know that the definition's been changed, they're going to have to decide for themselves if they even want to trust or believe all of the numbers coming out from government from this point forward. And if they immediately say, I just don't trust these numbers anymore, they've changed the definition, they're off the charts now, I don't trust it. That doesn't help us from a public standpoint to put out numbers that the public are going to distrust. Doesn't work in our favor either. We're trying to communicate everything openly and honestly. Again, someone could make the argument that this is more communication, and I can understand that argument if the public understand what's going on. But this is such a technical decision that here we are sitting here, all of us following along on this story very intently for the last several weeks, and it takes a very technical presentation to get there. And I just worry that it's not going to be well understood other than simply saying, don't worry about the numbers changing. They changed the definition. It's not comparable. It's not the same thing. Don't worry about it. And if you give a flippant answer like that, it runs right into that narrative of don't trust the numbers anymore.
And there's no guarantee that even if the state keeps these numbers separate, that media will.
That's absolutely
That's true.
right.
It gets disseminated to you.
That's true.
So there's just so many opportunities for there to be bad information.
I want to welcome everybody with us here today, and I especially want to welcome the Vice President of the United States, Mike Pence. Thank you, Mr. Vice President, for being here today.
Thank you, Governor.
Well, we need to understand that COVID-19 has taken a very swift and very dangerous turn in Texas over just the past few weeks. And the positivity rate that just 1 month ago was at 4.27% is now well over 13%. Now, one thing I said from the very beginning, and that is that Texas will follow data in making decisions about how we move forward. One thing I declared early on is we would be looking at that positivity rate because the positivity rate shows us a measurement of the way in which there is community spread in Texas. And with a positivity rate of over 10%, I declared early on, it would be an alarm bell for Texas to take action to rein in the spread of COVID-19. Texas still has the second lowest death rate of the top 27 most affected states in the country. We cherish the lives of our fellow Texans. We must all come together and all work together to make sure we do all we can to continue to protect the lives of our fellow Texans. And it will take these, worn by everybody, in the coming days to make sure that we will protect those lives and we will slow the spread of COVID-19.
It doesn't matter if you sanitize surfaces. It doesn't matter if you're washing your hands, and masks don't work. If you use only proper studies, randomized controlled trials with verified outcomes, they all unambiguously say that there is no statistical evidence of a benefit in terms of reducing risk of getting a viral respiratory disease. They all say it. And the reason is that we know that the main transmission route of all of these types of viral respiratory diseases is very fine aerosol particles that are supported as part of the fluid air. With those kinds of particles, they're going to get through the sides of the masks, even the tiny wrinkles you have in your skin and so on. There's no way you can prevent these aerosol particles from either entering or coming out. So masks are not going to work under these circumstances, and we know and we understand why you get this transmission in the winter, and that's because these fine aerosol particles are stabilized in the air when the absolute humidity is low, and as soon as summer comes around and there's more humidity in the air, the transmissivity drops to a factor of 4 or 5 lower. So they just go away. You don't transmit them anymore. We know why masks shouldn't work. It would be surprising if they did work. And so it's not about droplets, it's not about spitballs, it's not about surfaces and fomites and all that kind of stuff. It has nothing to do with it. It's all about buildings where you have fine aerosol particles suspended in the air of the building. They can be measured, they're in high concentration. That's where the transmission occurs. So you're looking at daycare centers, hospitals, potentially places where the air is fairly closed in. That's where, and people's homes as well, traditionally, and that's where transmission occurs in the winter in mid-latitude countries. This was not a killer event. The winter burden mortality has not been greater than usual. There was an anomalous peak there, which needs to be investigated criminally and through real methods of discovery of what happened and investigation. And because it is a big anomaly and it targeted some very vulnerable people, and that needs to be investigated. So if I was in charge of public policy, there'd be some serious investigating going on and outlining exactly the chronology and the circumstances of those deaths that happened very suddenly. There was an acceleration of, I would say, killing off some very vulnerable people in some centers where this was happening. It's frustrating because the top officials, the government officials, the health officials, are talking nonsense, total nonsense,